fostering deeper relationships, influencing behavior change, developing resilience. You're about to start winning. Here is your host, Christine Bright.
Welcome to Parenting Game. I am so glad you are here. My guest is Kathleen Harwood with In the Moment Child and Family Therapy. Today we're going to be digging into a pretty deep topic, childhood emotional neglect. Kathleen, this is a big one, and I thank you for jumping into this topic with me.
I thank you for the opportunity to dig into this topic because as a therapist and also as a parenting coach, this is one of my passions. Many of your viewers probably have never heard of childhood emotional neglect. So I would like to define it for you and for your audience. I also want to kind of give a little disclaimer. If you hear yourself here, don't be surprised. This could rattle your cage a little bit because I think this is far more prevalent than we know. So let me define what childhood emotional neglect is and what it is not.
Absolutely.
Okay, so childhood emotional neglect is when your parents don't pay enough attention to emotion. For the vast majority of people, their parents are good people. They have clothed them, they have fed them, they have housed them, they have had toys and an education and even vacations, and they know their parents love them, but there's something missing. And what is that piece? It's that their parents didn't know, couldn't, or wouldn't deal with their emotions. And a parent's job is to help them, help their children to deal with emotion. We like to believe in our nation that we are logical thinkers. And cognitive psychology has proven we are not logical. We are nowhere near logical. We are, in fact, emotional beings who occasionally think.
Yes.
But we like logic. We would sort of like to be like Spock or like robots, that we don't have, I can think logically, I don't need those messy emotions. But our emotions inform our logic. And when our parents didn't give that to us, we do not have that knowledge and that skill set to then give to our children. So it gets passed down from family to family to family for generations. And so when I work with parents who are trying to help their children, this topic often comes up because as we talk about what our children need, parents often say, wow, I didn't get that.
Yeah.
And now they are faced with not only their child's needs, but yikes, you brought this up in me.
Yes, and it's something I need to develop. So two, before we move forward, I think it's important to define what it's not. Because I think people's minds tend to go to, it sounds like an abuse word.
It does.
And that is not the case.
Correct. Well, let me define that a little deeper.
Yes.
If there is someone who has abuse and neglect in their childhood, you don't abuse and neglect your children and still pay attention to their emotions.
Correct.
So when there is actual abuse and neglect, childhood emotional neglect, or CEN, a much quicker way of vocalizing it, goes along for the ride. It just does. There's no way you can avoid that. But for the vast majority of people, this isn't abuse. This isn't neglect. And so one of the ickiest pieces when I'm doing treatment for adults with childhood emotional neglect, which is something my practice specializes in, one of the biggest hurdles is to make this clear that we are not here to throw mom and dad under the bus. They did the best they could with what they had, what their parents gave them. And as we dig into this piece, we often talk about, well, what was mom and dad's childhood like? And we really kind of go back a few generations. And what we find is mom and dad often have their own stuff. And so they brought what they could. And we have a lot of compassion and a lot of grace around that.
Also, too, you know, and I'm going to share just a piece, you know, personally. When I went through the divorce between my son's dad and I, there was a time where I did not address his emotions. I mean, I was so overwhelmed and consumed with my own grief and shame, and, you know, did not do that. So is there also then where you know, as a parent, maybe overall you do well, but there might be these periods
Absolutely.
of what I, you know, say traumatic, you know, incidences
Absolutely.
when you don't. And I want to save this for a little bit later because there is a redeeming piece in this. But, you know, to make parents aware of that.
Yeah, absolutely.
You know, if there's like some type of the traumatic events, it might later, once healing has taken place, to go back and look and say, was I there to help handle my kids' emotions? So, you know, too, it can happen during periods of your life. It can be something you need to prove on overall, or there might be these periods where you need to go back and heal because you weren't
So
able
there are
to.
many types of what we call CEN parents. And they can be neglectful. They can be narcissistic. They can be oblivious. But they can be on military deployment. There can be a prolonged illness in the family. There can be mental health conditions. There can be deaths in the family. There's all kinds of things that can happen within the dynamics of families. You know why? Because families are filled with human beings. and we're not perfect, and you know, I don't think we should be trying for perfection.
No kid wants the perfect parent.
Yeah, yikes, right?
I mean, who wants to be around somebody who's perfect? So,
right.
But it is.
And what we're looking for, though, is good enough parenting.
Yeah. We
know through research that good enough parenting means that we're tuned into our children's emotions, say, 70 to 80% of the time. Now, how we measure that beats me.
Yeah.
But that's a piece. That's totally a piece. And that's why I'm saying, if you go back, I work with people who, like, mom or dad were abusive, or they were narcissistic. Everything was about them. And that's okay. That we have to be able to articulate exactly how mom and dad failed us without throwing them under the bus. We're understanding they're humans and they're fallible and they're not perfect. Here's the beautiful part about CEN, though. It's highly treatable.
Awesome.
CEN was identified by a woman, her name is Dr. Janiece Webb. And what happened, she's a therapist like I am, and what she noticed is that people were coming to her for things like anxiety and depression. And she saw this constant thread of they don't know how to tap into their emotions. They don't know how to name their emotions. They don't have an emotional vocabulary. And it's almost as though they're trying to shut that off, and they're trying to understand why they feel what they feel. Well, there's a reason for that. And I talked about we're emotional beings. So when we try to suppress the emotions that we're uncomfortable with, anger, disappointment, disgust, frustration, any of the things that, these are the uncomfortable emotions, we also suppress joy and gratitude and contentment. All boats rise with the tide. They also all sink with the tide.
That's a very important point, because going back to, you know, with our kids and handling their, you know, being able to step into their emotions with them, that we don't think about that. You know, sometimes it comes out of the goodness of our heart. We see our child disappointed or sad, and then we step in to try to make that all better for them.
And make it go away.
Yes, and then but we don't realize that you're also then going to start suppressing those other emotions like joy and happiness.
So whether this is appropriate or not, I'm going to share a personal story.
Please.
Okay, so
always appropriate.
So why, you know, first of all, when I meet with parents or I meet with an adult wanting to treat CEN, I use a 22-question kind of a questionnaire to see where they're at. I've never seen anybody get a 0, ever in my whole life. me included. So my story, my parents were Depression era children.
Oh, okay.
So they came out of an emotionally deprived environment, and now they're parenting my sister, my brother, and I, and did astonishingly well considering what their background was. But there was this one piece, especially for my father, tears, crying, made him so uncomfortable. And the nonverbal, it was never said, but I got the message. If you're going to cry, take it somewhere else, because I don't want to know. Why? Because when our children cry, it makes us sad. It brings up stuff in us, and I don't know where to go with that, so please take it away. And it perpetuates the cycle. So unless my father could learn how to deal with tears of his own, he couldn't deal with mine. It wasn't that he was trying to be unkind. And so years later, the first time I went to therapy was in my early 30s. Guess why? I couldn't cry. I couldn't cry.
Yeah.
I had built this lovely, lovely wall because tears meant I was burdening my father.
Yes.
And so I had to learn that crying is normal and it's human and it's okay. And it's okay to be human because that's what we are. And so, as I mentioned, if you don't have this, how do you give it to your children? So when we do some parent coaching, almost always this piece comes up.
Absolutely. Well, because no parent is perfect, right? I mean, even, we got to recognize that in ourselves.
Absolutely.
That there may be times that we have to go back. So when, now we got this heavy stuff and parents are probably going, oh my gosh, what
have I wounded my children?
My children. So when you realize this, and you take that time and you're going, oh, okay, here's either a thread through my parenting, or you recognize, oh, there's situations where I did not honor their emotions. Are you just now, is there any way to heal that? Or is it just kind of like, oh, darn it, hopefully I won't do it again?
Correct. Well, I want you to understand that I have people in my 70s healing from childhood emotional neglect. So it's never too late. It is never too late. But you do need to learn a different skill set, and you have to take the steps to do your own healing. If you do your own healing, you now have it to give. And that's why I'm so passionate about this topic, because if I can teach parents how to do it, this is how their children are raised. We parent the way we were parented, generally speaking. It's kind of our default mode. Guess how, if your children get this from you, guess how they're going to raise your grandchildren? And the cycle stops. And how amazing would that be? And so I kind of want to shout this from the rooftops. So when I do parent coaching, I'm actually trying to prevent future cases of childhood emotional neglect.
Yes. And one of the in the study guide that I do, which I put it in there because I figured it would be helpful, but didn't realize how powerful it is. And one of the activities they do is write down ways they want to parent like their parent, their parents, and ways they don't.
Absolutely.
And they're often surprised, because when they're sitting down and really evaluating, like the things they liked and they don't like, sometimes they're really surprised. And I think the surprise is they're like, I don't like that, and I'm doing it too.
You bet. It's default mode.
Now what? So you have a parent. They start digging in, start healing from their own emotional neglect. But now they've realized, okay, I've seen this as a thread in my parenting with my child. Or you have the case of, oh, there was a period of time where there was this trauma going on, and I did not. How do you go back and heal that within your kids?
Sure. So as you heal this in yourself, it naturally flows into your parenting. The only thing that will heal it is to change it. The minute we begin to embrace our emotions, and I have an analogy that any of my clients are watching this are going, oh yeah, this is Kathleen, she does this. I like to use the analogy of a check engine light in your car. I've had one going because I've had this slow leak in my tires and my light keeps coming on. I was not happy to see the light, okay? Our emotions, especially the uncomfortable ones, are like that check engine light. And I had a choice. I could just, I don't know, ignore it or put a piece of tape over it, pretend it's not happening until, of course, I'm sitting by the side of the road with a flat, right? So the check engine light, while it wasn't information I really, really wanted, it was really, really important. And when we begin to recognize in ourselves that these emotions are telling me something, when I feel sad, when I feel anxious, it's telling me something. Pay attention to this. When you can begin to embrace that, begin to develop a vocabulary around emotions, as you get more comfortable with yours, you will naturally, thinking to my father, you will naturally then be able to start doing that with your children. You will see them as emotional beings, and you will be able to normalize it. And at first, they might be a little weirded out. I'm not going to be like, what is this?
Yeah.
You know, this is weird.
What? Mom is talking about all these new words.
Yes, and it may take a little time. That's okay. So what does the parent say at that moment? Yeah, I know. You know, I didn't, just own it. You know, I didn't always do this well, but I want to do it well because you're really important to me.
Yeah, so going with that, I didn't do it well. So is it helpful, you know, because again, you know, okay, now I realize this, it's uncomfortable. Is it helpful to go back and acknowledge those times with your kids? Or is it, because typically we're just like, okay, well, I'm going to do better moving forward now that I have this information.
We're so afraid to be human with our children, aren't we?
So we'll just let that lie. But it is helpful to go back if you've recognized some of those, to go back.
Yes. One of the greatest gifts I was given, I brought up my dad, I might as well bring up mom, right? My mother and father grew up in really emotionally deprived households, but my mother had this ability that when she would punish us or scold us, or she realized she was wrong about something, she would come and say, you know what, I'm sorry. And she would often say, you know, kids need respect too. That was super powerful.
And, you know, going into that, you know, I get this, does apologizing undermine your authority?
Absolutely
Did that undermine
not.
your mom's authority at all?
Absolutely not. In fact, it made her credible.
Yes, I like that.
It made her credible.
I like that.
She owned her stuff, and she showed me that it's okay for me to own mine. She modeled that behavior for me. Plus, she made me feel worthy. I'm worth an apology.
Yes.
And how frightening is it for us? We think that if we admit a failure, that now I'm giving my kids permission to do whatever. No, you're sharing your life experience, and you're sharing, hey, I'm not perfect, and you know, I didn't mean this, but I'm learning some new things. And I just want you to know. In fact, I've talked with all three of my grown adult daughters at different times saying, you know, I've learned so much since parenting you in my professional life and just from experience, life experience. I said, you know, there are things that if I could go back, I would do differently.
Oh, absolutely. I've done that with my son. I said, you know, the saving grace for him, and I say that. I said, what was really helpful for me is that at a young age, she was in 6th grade, became a foster parent.
Oh, sure.
And learned, you know, a lot of strategies that I didn't know existed.
Sure.
And really helped, you know, my parenting of him.
Sure.
So I was really grateful for that experience. But even now, as we continue to educate ourselves, as brain science comes out and we're learning new things, there are times I will go back to him and say, oh, dude, so do you know when, do you remember that? He's like, yeah, I remember that. Yeah, I'm sorry.
Yeah.
I wish I knew what I knew now.
Absolutely.
But, you know, it's been helpful for him because, too, you know, even though he's 27 years old, he's maybe a dad someday.
Yeah.
You know, so I always look at it from that way. Sometimes it's really hard to do, but as you said, we're going to have, you know, grandchildren. You know, when do we want this to stop?
Absolutely.
So-
well, and the other piece is to remember that most parents, parenting is the toughest job you will ever have in the world and the one you have the least training for. If you have a job or a career, you trained for that. Somebody taught you how to do that. And the only training you have is the parenting you saw.
Yes.
So grace, compassion for yourself. Parents get so apprehensive about doing it right. My daughter just had her first child. It's my 7th grandchild, but her first child. And she is in absolute panic mode that she's, what do I do if this happens? I said, "Hun, you're going to wing it." Because that's what we do, we wing it. So much of parenting is on the fly. It's not scripted. And it's in the moment. It's in vivo.
Yeah. So share with me, and I don't know if you can have like a top 3, per se, but you've done this for a long time and worked with a lot of adults. If you can kind of package it neatly, what are some of the best advice that you can give parents when they may recognize that this is actually an emotional neglect issue? Now that I understand the definition of it, it's not abusive, it's just I'm not handling my children's
I don't have the info I need.
Yes. So what, and again, just of course, ultimately, the biggest step you can do is take that step to get into therapy and fix all that.
Absolutely.
But in the time being, as they're figuring this out, what are just some helpful tips if they see that, what they can do differently moving forward?
Well, first of all, identifying it is huge. So if you're sitting there right now watching this program and you go, "Oh my goodness, that might be me," I would refer you to drjaniece.com, drjaniecewebb.com, and take the 22 question test. You can contact me and I will give you that assessment tool. And the higher you score, the bigger we've got, okay? When you see that number, understand that nobody gets a 0 and that this is highly, highly treatable. Once we name it, we've got it. So the next step then is, if you enter your own treatment, I believe that your child's best therapist is their parents. If I can teach the parent, I'll be honest with you, as a therapist, I'm probably ruining my business. Unless we're talking about some really big stuff, I can't touch what a parent can do. As a parent, you have tremendous potential for damage, but tremendous potential for healing. And a parent with good intentions can learn to do that. So it starts with acknowledging what's happening, naming it. Then we begin to say, okay, how do I learn to, sometimes it's about naming emotions. I don't even know what I'm feeling. I just know I've got this feeling. I couldn't tell you if it's sadness, anger, and that emotions are very complex, and you may have more than one. In fact, you probably will have more than one.
Yes.
And learning how to tease that apart. Developing more of an emotional vocabulary.
Well, and one of the ways, a tool that I got from a gentleman, he's a pastor in Australia, said is the emotional wheel. And I use that in in the coaching, because as I said, this is a very common thing with naming emotions and being comfortable with them. And it starts with like the inner, like your basic ones. I'm happy, I'm sad, and then it goes out from there.
Yes.
And gives you more and more. And I have one. People can contact me. You can Google it.
Oh, you sure can.
And see it. An anger iceberg is really helpful.
Very much.
Because anger is the secondary, what's underneath that.
Well,
and having these tools
absolutely
to start naming.
A place that almost all of my clients start when they first start with me, even kids, is I send them to watch Brené Brown's first TED Talk, The Power of Vulnerability.
Oh, that's amazing.
Because it's 20 minutes long. It is kid-friendly. She is funny and real, and she talks about how scary that is. And so getting over that fear of emotions. one of the ways I think we try to avoid the pain and the fear of grasping our emotions is we say to ourselves, well, yeah, my parents weren't perfect, but hey, I turned out okay. And then I go, did you? Did you really?
Yeah.
Well, okay, so you're here why?
Yeah.
And so when I meet with somebody, I always ask about childhood, and many times they say, well, what does this have to do with anything? And how we, it has everything. We carry childhood into our adult lives. How we did relationships with our parents is how we're going to do relationships. So this is a very, very powerful piece for parents when you understand that you can grasp this and you can change the whole trajectory of your child's adult life. I mean, that's powerful, powerful stuff. And it's okay if you don't do it perfectly. But the big piece is often breaking through that emotional wall that we have built of necessity in our own childhoods because it protected us. It's how we coped. We learned to cope by not coping.
Yes.
You know, we plugged our ears and we sang la 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 la, and it's not happening. And I'm okay. You know, I know it's, I'll be okay. I'll be okay. What if we just stopped and said, you know, I'm not okay. I'm just not okay.
Yeah. And I want to do better.
Yeah.
You
and
know,
I can do better.
Yeah, I can do better. So we have the assessment, which is a helpful tool. Then we talked about, you know, Googling or contacting us to get, you know, an emotional wheel to start practicing, you know, more vocabulary around our emotions. How then, moving forward with our kiddos, what's some practical? So now it's like, okay, I'm aware. I want to start using better vocabulary.
Yes.
My child now comes to me with their emotions. What are some, I think the most helpful thing, what are some don'ts then? I want to do better with my child's emotions when they bring them to me. What are some don'ts in
Don't
that?
assume they can just handle it, because they can't. They're coming to you for a reason. So I'm more into a what do you do? So let me maybe answer that question with a what do you do? Because if it's sort of like a diet. You're not trying to avoid cheeseburgers and pizza. You're trying to add fresh fruits and vegetables.
Got it.
So it's what do you add? Because once you add it, there's no room for that other stuff.
I like that. Thank you.
Okay. So the big piece, there are two big pieces that I would start with. To understand, we talked about, is this abuse, is this trauma? I want to be very clear that childhood emotional neglect, or CEN, is a very specific type of attachment trauma. And I don't know that we have time to go into attachment theory, but please Google it.
We got about a minute here, so let's see what...
So to understand that this is a wound, and that's okay. We can deal with wounds. We can heal wounds. To be seen, heard, and understood is how we heal the wound. So the wound happens through not being seen, heard, and understood. That's trauma for a child. How do we solve that? With something I call attunement. I think other people use that term as well. If you think about what is attunement, is being tuned in. You're paying attention now, and you're not afraid of the facial expressions and the nonverbal communication and the words that your child brings, and you simply try to get to a place of comfort where they can bring this, and all I have to do is listen.
Yeah.
All I have to do is just attune and say, wow, that must be hard.
And that's easier, you know, that's easy. We just need to listen. Kathleen, I know there's so much more information on this, and I just thank you for what you've brought to our parents today. And I thank you for tuning in, and time invested in a child is never wasted.
Thank you for watching The Parenting Game. All episodes of The Parenting Game are available on demand at sunprairiemediacenter.com.